Would you like to understand the different types of headaches there are and how you can prevent them from happening? I recently did a headache series of 1-minute videos on all the different types of headaches, what triggers them, and how you can naturally take care of them, and I'd love to share it with you right now. Let's do this. Hi, I'm Dr. Rob Murray of Murray Family Chiropractic. I'm a corrective care chiropractor, and I specialize in helping people with neck pain and headaches. I'm going to show you the different types of headaches there are and how you can naturally take care of them. Let's start with headache number 1. If your headache feels like a tight band around your forehead, I know how to fix this. This week my videos are focusing on different types of headaches, and if your headache feels like a tight band that goes across your forehead and even wraps around the back, you more than likely have a tension headache. And there are a few things that we can do to help out with tension headaches. So number 1 is we want to make sure that we're loosening up the tight suboccipital muscles at the back of the skull that can get really tight right at the base of the skull. And to do that, we have our chin tuck exercise, where you glide your chin back, hold it for a few seconds, make sure you're not extending your head back. It's a glide, hold back for a few seconds, relax, and repeat for about 10 times. You also can have tension headaches from being too tight in your upper trap muscles. And to release your trap muscles, we want to basically pull your head to the side, and if you want, you can look upwards a little bit. Hold the stretch for 15 to 20 seconds and repeat twice, and do for each side of the neck. Your tension headaches might also be developing because of forward head posture. That can be from poor ergonomics, working on your computer, or looking down at your cell phone too often. So here's a tip to improve your cell phone ergonomics. Hold your elbows into your side while you're on your phone. It'll keep your phone up higher so you're not looking down as much. Also, make sure your ergonomics are good for your computer. You really want to make sure your monitor is high enough that your eye level is at the top of the monitor, and that will help prevent you from looking down too much when you're working. Combine the stretches, the chin tucks, improving your ergonomics on your computer, and how you hold the cell phone and look at your cell phone, and this can greatly help with tension headaches over time. Also, make sure you're well hydrated, getting your proper nutrition. Did you know that migraines are neurological based, but your neck can trigger them? Unlike a tension headache that feels like a band around your head, migraines will feel like they're coming from the inside of your head. You might feel them behind your eyes, but they'll be very pulsing, sharp pain. There are numerous things that can cause migraine headaches. They can be caused by stress, environmental exposures, food sensitivities, and even from your neck area. Misalignment of the cervical spine or the neck area is not the only cause of headaches, but it can lower your threshold or vulnerability to developing a migraine headache. Treatment of the spine to make sure it's in its proper alignment can help improve your headaches and help your body overcome the migraine headache and heal better. If your migraine headaches are frequent and they're not getting better on their own, I would highly recommend seeing a healthcare professional to be assessed properly. If you're in the Newmarket area, I'd be happy to see you. Feel free to DM me. If you have comments or questions on migraine headaches in general, please feel free to leave those and I'll get back to you as soon as possible. Did you know that not every sinus headache is sinus related? It could be coming from your neck. If you have a headache that feels like it's coming from behind your sinuses, but you don't have fever, you don't have sinus congestion, and you're not necessarily tender if you press on your upper cheekbones, you may not have a sinus infection or a sinus headache at all. Your headache may be coming from your upper neck area. Irritation of the joints in your upper neck have the ability to refer pain to behind your eyes and your sinuses. To test if your neck is actually the cause, simply move your head back and forth in different directions. And if you feel pain in your upper neck area, that joint dysfunction might be what's causing your headaches. If your headache starts on one side of your neck and feels like it's traveling up, this is why. This week I'm doing a different video each day on different types of headaches. And today's headache is cervicogenic headaches. It's a type of headache that you don't hear about as often, but is actually quite frequent. Cervicogenic headaches occur when joints are irritated, most often on one side of the spine, and the pain travels upwards from that irritated joint up into the scalp. This is very treatable. All you have to do is just slowly rotate your head back and forth from left to right. Don't push too far in either direction, but repeat that about 10 times. If you do feel like you have a swollen joint in the back of your neck, put ice on it for about 10 minutes. If the pain keeps reoccurring and your headaches aren't going away, I highly recommend seeing a healthcare professional in the area to get properly evaluated. If you're in the Newmarket area, you can send me a DM. Feel free to leave a comment if you have any questions about your cervicogenic headaches or any type of headache you're having. I'd be happy to help out. If you have headaches that develop later on in your workday, you are more likely getting screen headaches. Screen headaches develop from eye strain from looking at your computer screen or cell phone technology for too long. As part of my daily headache series this week, Today we're going to be talking about screen headaches and how we can actually prevent them from happening. Sometimes this just happens regularly with a long workday, or sometimes it's because we're working on an abnormal project that's making us look at screens a lot more than usual. Number one, make sure you have your eyes checked by an eye care professional in case you need glasses, or to make sure that you have the proper prescription from when you're working on a computer screen. Number two, make sure that your screen is at the proper height and distance. So your eyes should be about the top level of the computer monitor, and your screen should be about an arm's width distance away from you. And my third tip is to follow the 20-20-20 rule, which is every 20 minutes, I want you to look away from your screen, look at something that's 20 feet away for 20 seconds. This basically removes the tension off of your eye muscles that are continually focusing your eye in a certain manner when you're looking at your screen monitor ahead. It's good to turn away and focus on different objects at different distances so your eye muscles are working differently to give them a break. Just like you want to get up and stretch for your shoulders and your neck when you're working on a computer a lot as well. If you are spending lots of time working on computers, you might want to follow my posture videos and tricks and tips for keeping your neck and shoulders in good posture and alignment while you're working on computers. Why do I only get headaches on the weekend? I'm going to tell you why. It's more than likely one of three causes. Number one could be caffeine withdrawal. You might be drinking less coffee over the course of a weekend than you do during your work week, so make sure to keep your caffeine levels consistent. Number two, it could be a buildup of tension and stress from your work week from working on computers. As that tension builds up, you could easily be developing a tension headache, but even though you didn't get the headache at work, it actually surfaced over the weekend. Number three could be neurological letdown. This is your work week being really busy and stressful. Your nervous system was building up all this tension during the week, and as you got to the weekend, boom, it just exploded and let down. Nonetheless, take care of yourself, hydrate, make sure you're reducing your stress. Here's a telltale sign that your work is too stressful. If you take a vacation and you don't get any headaches on that vacation, then your work is too stressful. If you get headaches after your workouts, this might shock you. As part of my video series this week, I'm going to show you why people can get headaches after working out. There are three main reasons. Number one can simply be hydration. Maybe you're not drinking enough water before, during, and after you're exercising. The number two reason could be improper breathing during your workouts. Make sure that when you are lifting, that you are inhaling on your eccentric contraction, which is when you are lengthening your muscle, and you are exhaling on your concentric contraction when you're shortening the muscle. So it look like this for a biceps curl. Number three can simply be overexertion, especially for exercises that stress the upper traps. So if your workout partner loves to do shoulder shrugs, maybe tell them to take a little bit easier next time at the gym. If your headaches match your menstrual cycle, this is why. Throughout the course of a menstrual cycle, estrogen levels can fluctuate, and this fluctuation can actually increase your pain sensitivity. Couple that with poor neck posture, it can increase the intensity even more. So to help reduce the effect of estrogen fluctuations on your pain sensitivity and headaches, it is good to make sure that your neck is in proper alignment and in good posture. Quite simply, reducing mechanical stress lowers the total stress load. If you notice a pattern of getting headaches at particular times of your menstrual cycle, track it for a few months and see if that pattern consists. Do some exercises from my previous videos that help with neck posture, like chin tucks, neck stretches, and see if your pattern changes. You might be surprised. This headache I'm about to talk about today is often referred to as the worst headache on earth. It's cluster headaches. If you get intense pain on one side of your face behind your eye, and often the headaches come back quite frequently, you are more than likely experiencing cluster headaches. And unfortunately, they occur just as they are called. They come in clusters. Cluster headaches can reoccur very frequently over a short period of time, which can be really hard on people who are suffering from them. These attacks can happen daily for weeks or months on end. Aside from extreme pain behind your eye, you can also have excessive eye watering, redness of the eye, and a runny nose. Unlike tension headaches, cluster headaches are neurological, and they need a proper diagnosis and treatment plan. So if you are getting severe, one-sided headaches behind your eye, please don't ignore it. Talk to a healthcare professional and get it addressed as soon as possible. Not all headaches are safe. This is what you should look out for. Hi, I'm Dr. Rob Murray. I recently did a series of videos on different types of headaches and what triggers them. But if you have a headache that just feels like the worst headache of your life, I want you to go directly to the emergency room. Sometimes an ultra-severe headache can be a warning sign or a symptom of a stroke developing. If you have a headache that is coupled with slurred speech or confusion, please get to a hospital. My channel focuses on mechanical headaches, not medical emergencies. So remember, safety first. If you have a very severe headache that feels really abnormal for you, or it's coupled with confusion, slurred speech, please don't hesitate. Go to a hospital, get checked out by medical professionals, make sure that you're not developing a stroke or something else, and let's take care of ourselves. So there you have it. We've gone over all the different types of headaches there are, what triggers them, and how you can naturally take care of them. If you have more questions about headaches, feel free to add comments and I will get back to you as soon as I can. If you've enjoyed this video, please like, comment, subscribe to my channel. Continue to watch my channel because I will have more content on how to help neck pain and headaches in the future. Thanks again for watching. I'm Dr. Rob Murray of Murray Family Chiropractic. I'm a corrective care chiropractor in Newmarket, Ontario, and that is my 1 Minute Wellness.